the main challenge we're facing now is we're a nation that feels like its hope is ebbing. And the best way to deal with hope is to have purpose and then lean into it. And you want to control your destiny. So the ability to wear a mask or put gloves on or clean up the thing you're doing or wash your hands, that gives you control. Because crazily, as much as you may fear the virus and all the things that are happening in Washington or your state capital, fundamentally, it's you that has to decide whether you're going to get this virus and who's going to get it and how you're going to deal with it. So if you can put a facial covering on, which you can make yourself, and that catches some of those little respiratory droplets that happen when we speak to each other. Because the way the virus passes is this. I'm speaking to you and go, I want you to be healthy, right? That sound makes spit. And you have this sort of plume, this cloud that goes out about 6 feet with my spit in it. If you're in that cloud, it goes in your nose, you get the infection. Young people get it less often because they have less places for the virus to go in their nose than older folks. That's literally the reason. And so if you can put a facial covering on, you catch that little sputum. It's not as good as a surgical mask, which we don't have enough of. So you can't wear them, but you'll catch those. If you wear gloves and you touch something that the saliva landed on, as we were just having a conversation, then you won't be able to, when you take the gloves off, touch your face and contaminate yourself. It's basic blocking and tackling, but no one can do it for you. And those are the most important things you can do.
And so it is probably then also very important that those gloves be disposable. They're disposed of immediately before returning to the house. And then also that those masks are cleaned regularly.
The masks you can put in the washer. I make them out of bandanas. And there's just like washing your hands kills the virus. Literally, the soap particles poke holes in the virus capsule. And also you surround the virus and it gets washed off in the water. Same thing happens when you put it in laundry. And the same thing happens when you wash dishes, by the way. It cleans it in all different fashions. And then all you got to do is make sure you don't putz with it the whole time. The more you touch your mask, the more you touch your face.
Exactly. Okay, so help me. This is the part that I call you for all the time. Help me not become the hypochondriac, right? Where now I'm like, is that a tickle in my throat? Is that the corona? Oh Lord, are those allergies or is that corona? What should people know? Or what advice do you give people who are thinking that every out of the norm or maybe even seasonal reaction in their body might be corona?
Well, first off, 50% of the people, half the people, no symptoms. So forget about the scratchy throat and the itchy
50%?
eye. 50%? Yeah, no symptoms. That's a big issue because you don't know you're contagious, even though you are. And so you're walking around having a good time with your friends, and by mistake, you're infected them. And not everyone who gets the virus does as well as you do. So even if those little scratchy things are not the virus, you may have already had it independent of all that. Secondly, the survival rate for people under the age of, 55, 60 for this virus is skyrocketingly high. Like it's in the range of regular influenza. And so those folks don't have that much to worry about. Are there horror stories? Yes. Do people end up in ICUs? They're young? Yes. Do they die? Not really. They don't seem to have the complications of the older folks. And there's a lot of reasons for that. Part of it is it's harder for the virus to get into young people. We don't have the right receptors for the virus. When we do get the virus, our body can deal with all the headaches. A lot of the disease of the virus is not the virus itself. It's our body's overreaction to the virus that causes a civil war, right? So in older folks, you don't have room for error. The body won't take the joke of the infection, so you run into the doldrums. So I'm very worried about older folks. We quarantine them, keep them away from everybody else. Got to make sure that they're connected socially. We love them dearly, so we don't take the kids over to see them. But that's the group that I'm worried about. The younger people, we're going to figure this out. But our obligation to each other is if we do have something that could be the corona, right, virus, then you got to pull out. You and everyone that you've been close to those last couple of days, you've got to pull back and quarantine yourself till you're sure. And by the way, what does close mean? Closer than 6 feet for more than 10 minutes. That's the definition of a close contact.
Okay. And so what do you think about, like, I'm getting, especially now being here in Los Angeles, I'm getting all of these emails about support your local businesses, getting food deliveries, getting Amazon deliveries, getting these things sent to the house. But I also started thinking about how, while I want to support my neighborhood and the businesses here, I'm also kind of concerned about ordering food from a restaurant. I mean, does that seem like in your opinion, does that seem like maybe a safe choice?
I think it's a safe choice. I'll tell you why. We have no evidence that the virus is passed through eating. The receptors that pick up the virus, that let it get into your body, don't seem to be there, or the stomach acid destroys it but it doesn't get into your body. So with that said, the food itself being safe, then the question is the containers. So if it's coming to you and it doesn't have to be touched immediately, giving it a couple hours lets the virus die on the surfaces. That's pretty easy. Then if it's a takeout meal, take the food because you want to eat it while it's warm. Dump it into a container that you own and throw the box away. And then wash your hands. So it's not a lot of virus load. Whatever's there, you can get rid of, and you can still eat the food. So we don't hesitate at all with takeout. The one thing I would do is if you had a lot of plastic containers because you're buying produce or something, just wash that with a like 1 part bleach, 5 parts water, just to keep it clean so you don't have to worry about keeping those out of everyone's reach. The rest of the stuff, just let it sit for a couple hours. You'll be fine.
Okay, so what about the mood of people, right? I have noticed going to the grocery store that people seem a lot more suspicious of one another, that people seem, there's almost like oddly this stigma that seems to be attached to if you may or may not have some sort of symptom or that kind of thing.
Yeah, if you want to clear out the grocery store, go in there and cough.
Exactly.
Yeah. People are worried. Again, I get it. I understand why folks are fearful. If I just could remind everybody that the overwhelming odds are you're going to be just fine if you get it. You probably won't even know if you get it. That's good to understand, but I respect the fact that people are social distancing. You've had that, that you get this, you're scared for a reason. Everyone's telling you to be scared. But there's a difference between being worried because you don't want to get infected and panicked, petrified by it. It's like doing anything else in life. A little bit of conscientiousness, a little anxiety, normal. Too much so that you can't live your life, not so normal. And I think we're actually doing a lot of harm by people overreacting. There's enough to react to without overreacting. There's enough bad stuff happens. Listen, I'm in the middle of it. I'm in the war zone, and the worst of the worst is here, and it's a miserable disease, and social distancing is a incredibly patriotic and good thing to do for our nation. But if you're miserable while you're there and unable to enjoy life, that's an unfortunate problem. It doesn't benefit anybody. And in China, we know that the social isolation caused by the quarantine in Wuhan actually led to about 50% of the people having depression symptoms. So a lot of the acting out, the paranoia that we're seeing is because people are depressed. The whole world is gray. And so the colorful technicolor life that we're used to living in every part of the country isn't coming there. But the good news, I think, is the worst week in New York is probably going to be this week. I'm hoping, I'm praying it is because everyone's exhausted. Then next week, we'll start to see a little improvement. The rest of the country will have its bad week next week or the week after, but it won't be as bad as New York. And then we start to actually think it's spring again. Even though we already are in spring, we'll start to behave as a population like we're there. And I do believe we'll bounce back expeditiously, but we cannot be emotionally scarred from the difficult days, the dog days we're living now.
Yeah. It's so interesting that you said today that you're talking about the kind of the height, because I think a lot of people are looking at the headlines and it's like, it just seems to be getting worse and worse and worse. And then different states, different cities shut down at different points. When do you think we could see, and I know this is like you looking, I'm not necessarily asking you to look into like a magic 8-ball or anything like that, but like, when do you think that life could return to some sort of normalcy?
My belief is that June is going to be a much, much better month than May. So I think we come out of this in May, much of the country, a lot of it like New York, maybe LA won't because it's too risky and we're still reeling from what's happened. But by June, most of the country will have flushed through the big pandemic bolus of sick people. The hospitals start getting a little more room in them. And then we can actually take the tactic that should have been done in the beginning, which is test, isolate, quarantine, and in order to contain the outbreaks when they happen and let the rest of the country go back to work again. It's not going to be all perfect. We're going to have slip-ups, but with testing, we won't be blind anymore. The single biggest problem we've had is no scenario, no simulation in this country ever predicted we'd have to deal with the pandemic without information, without testing, because we're basically flying blind. With the right kinds of testing, we can prevent what's happened from happening again.
So what do you think if I'm a person who seems to be exhibiting symptoms, at what point would you say it is appropriate to reach out to my doctor or to head to a hospital or urgent care to see about getting tested?
But when we have tests, which is not today, but let's say 2 weeks from now, when we have tests, if you have symptoms that are consistent with COVID, which go from fever, cough, malaise, intestinal problems, and through some of the more subtle things that we've been discovering of late, like loss of smell or taste, you should go get tested. Don't go to a hospital. You'll get infected there. Go to your doctor's office or to a drive-through clinic. They work just fine. However, today, no, you're not going to do any of that because we don't have testing kits. So if you're not short of breath, I'm going to tell you what your doctor's going to tell you, almost for sure. Depending on any of the medical problems you have, they're probably going to say, stay at home. That's what I tell my patients. Quarantine yourself for, for at least a week. You got to deal with this issue. If you get short of breath, call me. Otherwise, make sure they deliver good food to you because you're not going anywhere. And that's rough. That's the game plan. And most people do just fine with that.
Now, I've been hearing a lot about what's being considered the potential baby boom, right? That there are going to be a whole bunch of babies that we see out of this in the next 9-10 months. Are there any concerns if a person or a mother is with child, carrying child, or becomes pregnant and does have signs of COVID-19? Or is there any issue with the pregnancy?
Let's start in the very beginning. Breaking news, the male fluid, we already knew did not have coronavirus. We just had studies done on the female vaginal fluids, no coronavirus.
Wow.
So you're not going to contaminate yourself that way. We are going to have a baby boom. To our knowledge, the virus does not go through the placenta to the baby, so the baby's spared. The mom also seems to do pretty well during pregnancy, which is not the norm. And when the baby's born, the baby can contract the virus, although the baby seems to tolerate it pretty well. And it probably comes from the childbirth process, we believe. So net, in 9 months, there'll be a lot of babies. There'll be healthy babies. The moms will have uneventful pregnancies. And hopefully much of this will be just a bad memory.
Man. And tell me what your thoughts are on this, because I just read about it myself. But Dr. Drew coming out and really just kind of apologizing, saying, I got it wrong. I wish I had gotten it right. What do you think about the idea that so many people at one point thought they had this virus well pegged, and now it's like, oh God, I guess we didn't really have all the information.
Dr. Drew is just more honest than most of us. I don't know of any medical professional who expected this. Most of us were slower than we should have been, not just in the medical profession, and we're supposed to know this, but even the world experts in this disease didn't get it. And our government leaders certainly were being advised by people like us who are slow to understand the magnitude of this. When you have something that is such a gargantuan shift from the normal paradigm of life, it takes a while for the human brain to process it. I don't know if anyone listening to my voice right now could have imagined us being here a month ago.
Yeah.
Forget about a week ago, a month ago. And so we, as a nation, we saw it coming. My show was in China. I was doing shows about coronavirus in China early on, and I still didn't appreciate how hard it was going to hit us. Most of us arrogantly thought we'll manage this better because, we're America. But from the testing, which we got wrong, through the early management and the lack of containment, and then right through the reality that we allow people to congregate in groups way beyond what we should have expected. And in cities like New York, it was compounded by the fact that we're very dense, right? So by far, it's the most densely occupied and populated city in the country. We use elevators, which are a catastrophe, because an elevator, basically everyone's walking into a cloud of spit. Same thing for public bathrooms. And then you're squeezed into a small space in the subways. LA was spared in part because your public transportation isn't as detailed and underground as ours.
Right.
So actually living apart saved you. Parts of the country are going to benefit by coincidence, but the parts that are congested like us are going to suffer. And if we're not careful about containment, we'll suffer again.
Tell me and this before we go, there are a lot of people that I have had conversations with have kept saying we cannot come out of this unchanged. We cannot come out of this the same way that we found ourselves in it. What do you think will be one of the biggest changes to how we live our daily life after COVID-19?
The new normal is going to be strange. We cannot go back to the way it was. The handshake is gone. It's dead. It's finished. I don't see us going back to the traditional hugging and partying it up where we're contaminating ourselves theoretically with lots of people until we have a vaccine. But I do believe throughout human history, there have been threats against us as this vaccine is offered. This is the existential threat to us, period. So once we have a vaccine and people feel safe, at least the less at-risk population will go back to a reasonably normal life. But we're looking at a couple years until that happens. And remember, we never went back to pre 9/11. The new normal became, for a bunch of reasons, the standard fare. We keep getting these virus infections coming out of different parts of the world as we live in close proximity to animals. So I suspect we'll have more of these. Hopefully they won't be as contagious or as deadly. But each time it happens, it's going to have a little PTSD for the entire human population. What we can't afford to do is shut the world down when these hit us. We've got to invest in the public health sector. And that's not just about putting a little money into research. It's talking about public health officers who are like detectives going around, finding out when there are these viruses that are beginning to affect us and stomp them down immediately. If we could have done that, it would have been a tiny fraction of what the world lost in value and the emotional trauma that all the viewers right now are feeling.
Yeah, I think a lot of people have read the stories, the news reports about the current administration's choices. My question to you is, has the current administration reached out to you for any sort of guidance, any sort of opinions, any sort of thoughts on how to handle this now and how to look forward?
I talk to the task force quite frequently. I've had them all on my show. They're curious. They want to understand insights from different parts of the country. I happen to be in New York City. I'm at the hospital that took the majority of the patients early on, New York Presbyterian. So they want to know what's happening on the ground. And the one thing I've learned is during a war, not everyone's got perspective because it's hard to get it. And so you need to reach out to as many people as you can and have a little humbleness, because that's the ultimate definition of success, is understanding that you don't know what you don't know, and you got to have other people looking into it for you.
Yeah. And my last question to you, Dr. Oz, it's not really a question, but it's actually a request. You are highly regarded in the medical field and also in television. If you could offer a word of encouragement to those people who find themselves on the front lines, who are going to work every day, whether they're delivering food, making food, dealing with patients and people in hospitals, regardless of what they might be doing, out every day, sacrificing themselves, what advice, what encouragement would you offer them?
Like all of America, I'm deeply respectful and humbled by the ability of so many folks, unsung heroes, who do the subtle things that make this country still march forward, taking on tasks at great personal risk. And history will judge you kindly and will always be applauding your heroic actions.
Question, last, just real quick. Who are you with? What are you eating? What was the last thing you watched?
I'm going to take a little. So last Arrested Development was the last thing I watched because I'm with my family. So if you're living with your family, that show has a lot of truth to it. I've got all my 4 kids, my wife, Lisa, who runs the prompter for me and does hair and makeup, wardrobe. My daughter, Daphne, from The Chew and the Dish, and she's with Gordon Ramsay on Master Chef Junior. So she's running the quarantine kitchen, which is all the cooking upstairs that helps feed the family. Each child has a role. My son, Oliver, does tech support because, they canceled his college for the rest of the year. So everyone's doing it's like a family farm right now. We're in the basement. I'm eating incredibly well because Daphne and my wife, Lisa, are New York Times best-selling chefs. So that part we're taken care of. But the most important thing we do is because we're quarantined with each other and the kids can't run away, they have to talk to me, which is, I tell you, as a father, it's a real blessing.
Yeah, right? You got to find the silver lining in this, man. Love on each other. Lean in. Everybody is healthy, though. Everybody is good.
Yeah, they're all doing well. We've been blessed. And I tell you, I feel badly because my city is in turmoil. It's a war zone, but we'll get through it.